All right, hey guys, welcome to Fully Armed. Today's episode, we're going to talk to Tatum Allsep. Tatum, I've known her for, well, as you'll find out through the episode, for many years. I wanted to interview Tatum. There's a handful of folks like her and Rhonda Paulson and Kurt Campbell of Men of Valor, Rhonda of Isaiah 117, because I believe so strongly in what it is that these people are doing. Tatum is one of these people. Music Health Alliance is something she started. You'll find out all the information about that, but it's something I truly believe in. Musicians such as myself, a lot of times will find it hard to have health insurance, and she has found a way to make that possible. So here we go, Fully Armed with Tatum Allsep. Enjoy.
Welcome to the Fully Armed Podcast with Chris Hennessee. You got your armor on?
All right, guys, welcome to Fully Armed. Glad to have you guys back with us today. I have my friend, Tatum Allsep. It's so good to see you, Tatum.
It is so good to be here.
We've been pals for 20...
Well, let's see.
Because you'll be able to count, right? You were at Vandy, right?
I was at Vandy, but I was not on the arts and science side.
No? No.
No. But I think the first time I really got to know you was when you were singing Frog on a Log at Vanderbilt Children's Hospital
all right.
about 18, 20 years ago.
So, yes, let's back up and go to that. So Tatum worked at Vandy. But just so everybody knows, Music Health Alliance is where we are now.
Yep.
And we're actually, and I always want to preface by saying we're sitting in the parking lot right now. So if somebody comes in the door or there's that's why.
That could absolutely happen.
And the generator's running so we can have some air. So I always kind of have to. Miss Judy's doing the best she can here in this summer
Miss Judy is doing great. She's doing a lot better than I would do, I think.
So we're on Music Row. Actually, this is her first trip to Music Row, too. So
this is a monumental
it really is.
Event.
So we met at Vanderbilt Children's Hospital, and it was probably early 2000s, and you were running a program there. And then I'll get to my song in a minute, but tell us,
legendary.
Like, what was this?
Vanderbilt wanted to fundraise from the music industry. So about $10 million annually would go from Nashville's Music Row to St. Jude. And Vanderbilt is a nonprofit hospital and has this amazing children's hospital. And they really, I mean, it's a jewel in our community. But they wanted to help build awareness. And at the time, I had... 2 young babies and needed to be off, and I was a single mom, needed to be off the road, and Vanderbilt was building this music industry relations department. And I had gone to Vanderbilt, but always worked in the music business, so it was a really good fit for me because I spoke both languages.
Yeah.
And the goal was to fundraise, but my goal was to help build access to health care for the music industry.
Right, like from the onset.
From the onset.
Right.
And
you went to Vandy, right?
I did.
Okay.
I did.
Right.
And my parents went there and my grandparents went there.
Wow.
So my dad played football and my mom was a cheerleader. So we kind of bleed black and gold.
Wow.
So at this very moment, Vanderbilt has won 2 games.
2-0.
So it's kind of like the Super Bowl.
2-0, I know.
We could end right now. We're good.
Oh, that's great.
But so that's why I was there. Building relationships with the music industry in Vanderbilt.
And I came in to sing some songs. And I spent a few years, even after you left, I would go through and do the musicians on call. And was that what it was that at that point in time? I can't remember if that was the program.
When we brought music therapy into the hospital. We brought musicians on call into the hospital. That was during my tenure there, building out programs. Now the Seacrest studios are there. I mean, musicians on call is now celebrated 25 years. I mean, it's really awesome.
It's amazing. I did it for a lot of years, and then actually the COVID year kind of messed up my rhythm with what I was doing over there, and it's changed stuff up. But so, and we'll go over a little bit more about what all that entailed, because that was a blessing to me every time I would go do it. But that day, I feel like we were just downstairs the first time, and I felt like we had like a stream to the rooms or something. I can't remember exactly. It's been a while back.
It was like high tech, but they could beam the stage downstairs into all the patients' rooms.
That's what I was thinking. So there we are, Vanderbilt Children's Hospital. I'm downstairs on the little stage. There were a few, folks out there, but I did the famous, and it's not my song.
Frog on a Log.
Well,
it was a hit.
So for the last 2 decades, every time we talk, you're like, Frog on a Log.
Oh,
so
I'll never forget it.
For those of you that don't know, I'll see if I can pull off the end, but there's a hole in the bottom of the sea, there's a hole in the bottom of the sea, there's a hole in the bottom of the sea, then there's a frog on a knot on a log and a hole in the bottom of the sea. And by the end of it, there is a germ on the flea, on the hair, on the wart, on the frog, on the knot, on the log, and the hole in the bottom of the sea. Very fast. And that was always a hit.
Well, there was a kiddo who was nonverbal, and he had struggled and struggled and struggled, and there was something about that song that was like magic for him, and he kept repeating it over and over.
That's great.
And it was such a gift to his parents and his whole team, and it was a songwriter coming in to play for patients, and you didn't have to do that. You didn't have kids then. I don't think Rachel was in the picture yet.
No.
But it was that resonated with me and always will.
Oh, great.
It was
great.
really special.
Well, it was special to me, and I know there are a lot of guys and people that do it, artists, songwriters, and that kind of stuff. But for those that are listening to this, check it out, Musicians on Call. It's a blessing to everybody. And the kids just light up. I mean,
music heals. There's no... If you're having a bad day and you're a songwriter or an artist, you got to know that what you do speaks volumes beyond what you ever thought it would when you might have written the song.
Yeah. And for the record, I did not write Frog on a Log. I wish I would have.
But you can perform it masterfully.
I added to it, that's for sure. So you were there at Vandy for a while, and then you decided to leave the for-profit and dive into the not-for. Is that correct?
It is. There was a segue. I left Vanderbilt to build a for-profit company that brought health insurance to the music business. And that allowed me to see. Let me rewind a minute, because what started this whole journey was I had been at MCA Records for years, and then got married and joined an artist management firm. And about as quickly as I got married, I got divorced.
Yeah.
We call that a starter marriage, and I do not recommend them. Don't recommend those.
Right.
But in that short window, I got pregnant with twins. And the boys, I went into the hospital at 21 weeks. They were born at 28 weeks. That's 3 months early.
Wow.
I was in the hospital for 7 weeks, and they were in the NICU for 9 weeks. And I had health insurance and maternity rider and had done everything I was supposed to do. I was like, I went to Vanderbilt. I can run a business. And I left the hospital with a $500,000 bill.
Wow.
And I was so embarrassed and thought, how does this even happen? My granddad was the chief of surgery at Emory, and I thought, you get a medical bill, you pay it. I didn't tell anybody. I liquidated every asset I had, and my granddad co-signed a loan that took 10 years to pay off.
Wow.
And what I learned through this from friends in the industry is this was happening to so many people. And I couldn't figure out how it had happened until I started digging into the actual policy. And the insurance policy I had then would not be legal now under the Affordable Care Act.
Wow.
It had all these internal limitations, and
Yeah.
that's not legal anymore. But that's what propelled me to want to learn more about the healthcare system. So at Vanderbilt, I got to see behind the curtains, how does the billing work? How do doctors schedule? How do you does one person stay this long if they have a procedure and one person stay this long? How do you negotiate? And then Kix Brooks sat on this committee we had built. He was the president of the CMA, and he's like, man, if you could figure out a way to bring health insurance to the music industry, that'd be really cool, because that's something we struggle with, because we're all self-employed or part of small businesses. And that's all I needed to hear. So that is when I started to dig into health insurance and learning about it. And this is way before the Affordable Care Act. This was like 2008.
Yeah.
And so I left to build a business that was for-profit, and we became a member benefit for the CMA and Americana. And it was a company called Sound Healthcare, and my business partner was a salesman. I mean, he was about the profit, and that's what a good business person does.
Sure.
I'm not a good business person. I really just wanted to help people.
Yeah.
Not a good business model.
Yeah.
So fast forward 3 or so years, I met my husband, and we got married, and he adopted the boys, and we had a new little girl, Molly, and I sold my business, my portion of the business, to my partner, and stepped back.
Yeah.
And in the middle of the night, we moved to Montgomery, Alabama for 3 years. In the middle of the night, I woke my husband up and I said, hey, does this dissolution agreement have a non-compete? And he was like, no, what are you doing? I was like, I just had a dream. And I literally wrote the whole business plan to Music Health Alliance.
You had a dream.
Had a dream about how to do it. I mean, I know it sounds crazy, but honest to goodness, my husband can attest to it. Because I had been noodling on, I know how to help people with advocacy. I know how to help them navigate the system. I can't figure out this payment mechanism. I mean, how do you remove the profit from health insurance? And the Affordable Care Act had just been passed, and I had a small 401k, and my husband was like, you know what, if you don't try this, you will regret it for the rest of your life.
Yeah.
So I cashed in my 401k and found an attorney in Montgomery and drew up the charter and the bylaws and went and begged people to be on the board of directors. And that was one of those people was Jay Williams, who we had, Jay and Dirks, and I'd kind of started in the music industry like the same week. Jay was in the mailroom at William Morris, and our kids were in preschool together. We had moved back to Nashville, and I was like, will you be on this board of this nonprofit I'm starting? He was like, okay, it's hookup at preschool.
Yeah.
What are you talking about? He was like, yeah, okay, whatever.
Yeah.
That's kind of how we started. I was on the coffee shop tour for a while.
And when was this?
This was 2012, 2013.
Okay. All right. So, yeah, it's been over a decade then.
Mm-hmm.
And it has worked.
It has worked. It's crazy. I mean, I still sometimes feel like, oh God, how are we going to keep the lights on this month?
Okay.
You know, I think if I ever stop feeling that way, maybe it's time for me to move on.
Yeah.
You know.
Well, so for folks who might not be aware, can you kind of walk us through what Music Health Alliance does? How does it work, and how does it affect? I know because I've seen it firsthand, and we'll talk not specifics, but we'll talk about that a little bit. But how does it work for the common person in the music business?
Yeah. So, as you know, most of the music industry is self-employed or part of a small business. So navigating access to health care, having an HR department or group benefits is just not in the equation.
Right.
So Music Health Alliance was built to do three things: protect, direct, and connect music industry professionals with access to health care and financial resources, so they don't have to be bankrupted by medical bills.
Yeah.
And in the United States, the number one cause of bankruptcy is medical debt.
Wow.
It doesn't have to be that way.
Wow.
So Music Health Alliance, first we protect, we figure out how are you going to pay for your health care need. Is it insurance? Is it through financial assistance? Is it grants? Is it a state program or federal program? Or
Yeah, so you're helping out on the front end before there's a reason you try to get everybody set up
we
in
do.
the best place.
I mean, that's, step one is got to figure out how to pay for it.
Yeah.
And then step two is, okay, you've got maybe you've got a new diagnosis, or you have a child with a special need, or you just learned you're pregnant. Whatever the case is, we will listen. Everything's confidential, and help you build a plan. Easy, step 1, step 2, step 3 of what needs to happen next.
Yeah.
And then we'll connect you with those resources. If it's grants from another music industry organization, or financial assistance at a hospital, or a way to navigate getting your life-saving medication at a cost that you can afford. Our advocates do all those things, and there's no cost.
Yeah. Wow.
And then we also have 4 different funds that have grown over the years that are funded by the health insurance that we write. With health insurance, there's a small commission, but now that we've grown, the small commissions are bigger, and that all goes into a fund that we then write grants back into the music industry to cover things like mental health counseling, diagnostic care, senior care, and dental care.
So we'll look at it from the base level, because I've been there. Musician, just moved to town, and like a lot of times, man, we don't know what we're doing, right? Like you're just moving there, and you're trying.
Yeah, I get it.
Yeah, you're trying to find gigs, and then I'm trying to think. Unless you get into publishing or you get into record label, there's not a whole lot of health insurance offered by.
No, not even publishing anymore.
Right.
It's SAG-AFTRA,
Right.
is the union option, and it's harder and harder to qualify for because people are living longer.
Right. So, and now, because when I moved to town, there were a lot of musicians, songwriters, aspiring artists. I'm going to guess it's tripled since then, in the amount of people that are here trying to get into this world. And you don't. I mean, unless you have the foresight to go out and shop and try to find your health insurance, you just don't have it. And a lot of musicians
or you don't even know you need it.
Don't know you need it. Well, yeah, especially if there's youth involved, right? Yeah. So I spent a lot of time on the road with guys that are, that have been in the business for 20, 30, 40 years and still can be in the same situation. So
you don't know you need it until you do.
Right. So if I am, John Doe, I just moved to town, I'm playing on Broadway, and I just got the gig with the new artist, and I'm out playing guitar with them. What do I do? Where do I go?
Well, you have to have made a living for 3 years in the music business.
Okay.
And that is important because a lot of people come here and they don't stay.
Yeah.
And the investment that we're making into our clients is so significant. We need to know they're going to be part of this ecosystem for years to come, because we just don't have enough money to get to everybody.
Yeah.
But more than likely, if somebody's getting a gig with a major artist, they've been
around for a little while.
They've been banging around downtown for a while.
I get it. Yeah, you got to. You got to pay your dues around here. It's Nashville.
You do. There's no overnight success.
No.
10-year town, the whole thing.
Yeah, 10 years?
Well, now,
25.
Unless you go viral on TikTok.
There is that. That's a whole new world we're dealing with.
It's a whole new world. But with that comes the trappings of overnight success, and that's a whole other world of mental health need, because your life changes overnight. But anyway, so you're out on the road for the first time. You're making a little bit of money, but it's not enough still to afford what you think healthcare will cost, and you start having abdominal pain and you don't know what to do.
Yeah.
We get those phone calls more and more, and that's where we step in and we put together a game plan.
So many people, okay, you go to work for a corporation and there's insurance that's involved. You don't really think about it. I think a lot of people don't. They just go, okay, I'll work here now. Yeah, I'll get on that insurance and I'm good to go. As a musician, you tend to not think about insurance till you need it. Mm-hmm. And, I've seen this firsthand. I have seen you guys in action, and it wasn't me. It was a friend of mine and that we both know. And man, he needed help. And man, like like that. You guys were
Yeah,
there.
this guy was. This guy had a heart attack on the road.
Yeah.
And he was away from his family, and he didn't have health insurance, and he needed a major, I think, quadruple bypass.
Yeah.
And with that, in a city you're unfamiliar with, one of our advocates stepped right in and picked up the pieces and helped him navigate. Ultimately, negotiating down hundreds of thousands of dollars in medical
Right.
bills. He's now fully insured, which enabled him to get the rehab he needed
Yeah.
to recover, and now he's back on the road playing.
He is, and he's doing great.
And it was amazing. I got to see the advocate meet the client in person for the first time, and it was magic. It
Yeah.
was the sweetest
Yeah.
thing, and I just was so thankful to be able to witness such a beautiful relationship, and
Well,
so thankful to be able to be a part of it.
And that's not the only one. Like, you guys you're working miracles, really. I mean,
But it shouldn't be this way,
Yeah.
Chris. I mean, these are like, I believe healthcare is a basic human right. It shouldn't be a privilege. I mean, the Hippocratic Oath says, just like if you're a musician and you have this gift, this craft with healthcare and medicine, the Hippocratic Oath is a pledge that physicians take, that they will practice their craft to do good, that they will do no harm, they will not overcharge, they will take care of anyone who needs it because they have been given this gift.
yeah.
And along the way, that's been lost, and profit has crept in.
It has, yeah.
It is so unfortunate.
Is it, we'll just go a little bit deeper here.
Yeah.
Is it fixable, or is it just so far gone that we can only hope to put a Band-Aid on the issue?
Well, is it fixable? With the current options that have been presented, no,
No.
it's not. It's just kicking the can, and the cost from one person to the other, that person usually being the patient.
Yeah.
There are too many middlemen making money.
Mm-hmm.
There's no cost control for medication or the supply side cost of medicine. The lawsuits from all over the place are
Yeah.
out of control. I mean, it's just greed from everywhere.
Right.
When I was starting this, I went and studied the Canadian system and looked at socialized medicine, and there are pros and cons to that. That's not going to work in the U.S. We're a capitalistic society.
Yeah.
But there is a way to build in more equality
Mm-hmm.
and access, and make pricing transparent. I mean, I don't know any other business where you show up to have a service provided and you have no idea what it's going to cost. You have no control over what it's going to cost.
Yeah.
I mean, that's just not a way to do business. But no one has questioned it. The patient, the consumer, has gotten a lot smarter over the years, especially through COVID.
Right.
And that makes me happy to see that. I mean, as the consumer gets more aware, you'll start to see a little more change. And one thing that is good is we used to, I mean, for the last decade, or since the Affordable Care Act passed, it's been on the chopping block. And what we finally have are things that people can agree on. Like, nobody wants pre-existing conditions not to be covered. Nobody wants medication to be unaffordable.
Yeah.
Nobody wants for mental health not to be covered, or pregnancy, or whatever. Those things everybody agrees on from both sides. We hadn't been at a place where everybody agreed on anything before until now. What cannot continue is the cost to the middle class. I mean, there are resources if you're not making money or struggling, but as soon as you hit the middle class mark, it becomes unaffordable.
Yeah.
A health insurance plan for a family of 4 can be more than your mortgage.
I mean, let's call it straight up.
Yeah.
if you make, 7 figures a year, then your medical bills are $1,200, $2,000 a month. I mean,
no big deal.
Not a drop in the
you can do
bucket,
that.
but you still can do that. If you make nothing, well, then you're in pretty good shape
Yeah,
too. But
there
it's
are options.
it's us that have to do the very high.
Right. I mean, it
premium.
is. It's my family and your family. We're not rolling in it. We're making a living.
Yeah.
But one of the greatest expenses for anyone who is self-employed, making, say you're a family of 4 and you make $90,000 cumulatively a year as a household, your insurance is going to be between $1,200 and $1,800 a month, just guesstimate, with a deductible and max out of pocket that's about $9,000 a person.
Which you're liable to tap into.
Yeah,
that
if
as
you have
the
a
year
kiddo that
goes.
breaks their arm or
Yeah.
needs a surgery, or
So
you
there's
get
almost
stitches
$20,000 a year right there.
Yeah.
Then you got to pay for your house.
Yeah.
So and then you got to pay for this and that, and all of a sudden you're at $50,000 a year. Mm-hmm. Well, a lot of families don't make that.
Well,
So
and
what do you do?
I mean, Chris, I honestly thought when I started Music Health Alliance, I guess I was younger too. I was still in my 30s. I'll be 50 next week, so things have changed.
Well, happy early birthday, by the way. I don't
In
know
your
anything
30s,
about that.
Yeah. I was still naive enough to believe that I could affect change on the national level. We're going to change healthcare. We're
Yeah.
going to build access. And what I realized pretty quickly was, man, it's almost like the mob. I mean, you don't mess with that.
Yeah.
Or I didn't have the means to mess with it. But helping one person at a time in our industry, we can build some waves and get some attention enough to impact our own.
Mm-hmm.
And by that I mean who can afford $20,000 a year? Or if you don't have health insurance and you need a major surgery, you could be looking at $500,000, $1 million in medical bills.
Yeah.
We can step in for our industry and solve that problem.
Right.
I mean, we understand the law, we understand how hard we can push, and we know how to hack the system to create access. What do other people do that are outside of the music industry or don't have that access? That's something I really struggle with, because it just shouldn't be that way.
No. No, it shouldn't. I mean, thankfully for musicians and for people around here, you guys are here, but you're right. There are a lot of industries or situations where people don't have that advocate,
Mm-hmm.
And it's tough. I mean, I get it. I've talked about this with a lot of folks, and you bounce back and forth. I can see both sides of it, I think that in heaven there will be universal health care. But
I do think that, yes. No more sickness.
Yeah, but I do think in the
No more insurance.
No more insurance. Because I'm telling you, I'm speaking
And that
for...
is my insurance policy. I mean, I do have health insurance, I'm happy to say.
Yeah.
Fortunate. But getting to heaven is a pretty good policy, too.
Amen. Isn't it, though?
Yeah.
I mean, because we're not going to avoid any of these situations we're talking about while we're here.
One thing is for certain, we're all going to die.
Yeah, we're all heading that way to meet the great physician.
Yeah.
So talk to me about how do you guys stay in business?
It's a terrible business plan. When I started...
Let me tell you something that you said that, because I thought about it. I got a buddy of mine who's a small business owner. He does very well.
Yep.
And years ago, he asked, so this was when CDs were being made, and I was making CDs, making records. So what's your goal, business plan wise? He asked me, what's the, what's your outlook? And I said, well, really from where I'm at right now, we make this record, we spend X amount of dollars on it, and then once I make enough money selling them to have it paid for it, then I'll go make another record. And he said, that's the worst business plan I've ever heard. And I'm like,
makes sense to me.
welcome to the music business, sir. So go ahead.
Well, and I think that's why the music industry made so much sense to me. I had to do an internship. That's how I even discovered the music business. And it was the first time I had been in this industry where it was like an industry of misfits.
Yeah.
I got them. I understood the people.
Right.
They were my people.
Yeah.
And it's always been that way since. But when I started Music Health Alliance, I actually changed banks because I knew our banker was also my dad's banker. And she would tell my dad that I was making the worst mistake, cashing in my 401k to start a nonprofit where all our services were free and no long-term fundraising plan. But what she didn't understand was the music business.
I was going to say,
and we started small and we have been lean ever since. I mean, our furniture in the office is... actually, our bank gave us the chairs around our conference table when they were renovating. Everything's begged, borrowed, stolen, thrifted. We are so lean, and that's very intentional because the money that we are raising, and every penny is raised through fundraising, individual donations, grant partners, and corporate gifts.
Yeah.
And it's hard. I mean, because we've grown every year, and we went from a budget of $30,000 to now it's $2.4 million. I mean, just saying that makes me feel like I'm gonna have a heart attack.
Oh yeah. Wow. Yeah.
And a lot of that, I mean, we grew exponentially during COVID, when the need went from how am I going to figure out how to navigate healthcare to how am I going to afford food and diapers for my family.
Yeah.
And so we went from a team of 8 to a team of 16, and growing fast, we had to meet the need, but that's not always the best business plan either.
Right.
Because there's a culture that has to be maintained. And so I think I've learned a ton through this process and realized how little I know. But I also, now we've been doing it for, this is our 11th year forward facing. And every year we have been able to raise enough money and even save a little. And that's our goal, is to continue to save a little so eventually we can have an endowment that can provide funding for the nonprofit. We are a long way away from that.
Right.
And it is hard to fundraise, especially in an election year. Everybody's real scared.
Yeah.
But I feel like, and this is what I said to my parents, and my dad even met with my husband to try to talk me out of doing this.
Yeah.
And I say that at every fundraiser when he's in the audience. I'll be like, you remember Dad?
Remember that?
Remember that time? Look at us now. And I have to remember that when I'm talking to my kids who are 22 and entering the world, not to squish their dreams, you know. But I believe in what we're doing so wholly. And I believe that there's something bigger here than us, and we're just fortunate enough to get to do it. We've figured out a way to navigate something, and I don't think we should ever charge for that. I think that it is something we should share with our industry, because the gift that they are giving, the gift that you are giving, heals the masses in a similar way to medicine. It's the broken hearts. It's also the broken bones. It's also what brings memory back when someone has been unable to recognize their loved one for years. I mean, the science behind music as a healing mechanism has grown and grown and grown and grown, and that's the gift that you're giving. This is a little something we can do to keep the music playing.
Well, it's a big something. It's not.
Well, you're really sweet.
It's not little. No, it's no joke, because it's one of those things that, again, you don't. It's underlying. You don't pay attention to it till you need to, and then, my gosh, it's the most important thing in the world. I mean, really, I'm telling you, I saw a man who was physically broken and then became, very mentally, like, what are you going to do? I'm out of work for a year. And man, you guys just worked a miracle. You really did.
Well, it's first of all, I've got an amazing team.
Yeah.
I mean, we have Sheila Shipley Biddy, who was the first female head of a record label in this town. She is the Medicare whisperer.
Yeah.
I'm not kidding. I mean, she can figure out how to navigate the most complicated system I have ever experienced.
Yeah.
And it shouldn't be that way for seniors.
Right.
And these fierce advocates who literally armor up every day and go to battle for our industry. And then the music industry that supports us. I mean, it's this really, and their relationships from our industry that go back decades. And it's hard to explain that to somebody from outside the music industry. Because being a part of this industry, it's not a choice. I mean, I'm sure at some point in your life, you're like, oh, why did I do this? There's so many easier ways to make a living. There are, same for us in the nonprofit space. But this is what we're supposed to do. And we want to keep that dream alive too, you know.
When I was walked in your office and you know, looking on the walls and seeing all the pictures, I see my buddy Dirks, you know, and I know that he's been instrumental in this, and it seems like Rodney Crowell's name comes up pretty often.
It does.
Yeah.
Rodney was one of our first believers, and he created our biggest fundraiser called Heal the Music Day. It's always the third Friday in October. I think it's October 20th this year. And what we ask, you'll start seeing some social media stuff about it pretty soon. But he was like, everybody's always asking the music industry for stuff to give us this and give us that and do a free show. He's
That's
like,
right.
What about we just ask the industry to give a piece of what they're doing that day or a show from that month, and not do anything else, not do anything that they're not already doing. And it resonated with so many people that we had helped over the years or worked with. And instead of maybe making a year-end contribution to a charity, they remember us on Heal the Music Day. And we'll raise about $400,000 in that one day.
Wow.
I mean, so it's really awesome. And that came from Rodney and his belief in, he's such a good human being. I mean, he speaks in prose and poetry. I mean, he's like so phenomenal.
That's awesome.
One day he called and I was really stressed out about something. He's like, okay, I need you to walk outside your office and take off your shoes and just stand in the grass and ground yourself. He's like, you're losing it.
How about that?
And there was something to that. I mean, he's really amazing. And Dirks is the whole reason we have a group health program. Is Dirks call about, God, it was like 8 years ago. He was like, yeah, I want to have group health insurance for my band. Yeah. And I was like, well, we don't do that. I don't know anything about that. And he's like, well, I want y'all to do it because I trust y'all and I know the money won't be, it won't be about the money. It'll be about what's best for my band. Yeah. And I was like, all right. So that was over Christmas break. By January 1, I understood group health.
Wow.
And he was our first.
How about that?
And now we've got, 50 or something groups.
Do you really? Hats off to Dirks, by the way, because, man, looking out for your band
he
like
did.
that. That's
and
great.
I got to say, Dirks, I will never forget the amazing artist who let go of their own assets to keep their teams on salary during COVID.
Yes.
And the ones that didn't. I'll never forget that either.
Yeah, I get it.
We met a lot of them at the farmers market. We had from the food bank, they'd given us vouchers for the farmers market, and there were a few bands that had been let go right before Christmas of 2021 with there was no severance, nothing. Yeah. And that's not, you don't usually get that in our industry, but that was a unique time. And I'll never forget those artists either.
Yes.
We won't go there, but
Yeah, I get it. Mm-hmm. How can people that are listening to this and checking into this, what can outsiders do? What is there some way to help or?
Absolutely.
All right. What is it?
First of all, if you're inside the industry and you need help, don't hesitate to reach out. You can go to musichealthalliance.com. If you're outside the industry and you're a music fan and you want to just support the health and well-being of the industry, you can donate.
Yeah.
Donate. For every $1 that's donated, we can turn it into $30 in healthcare resources.
Really?
It's amazing.
Wow.
And what that is negotiating down medical bills, figuring out how to navigate health insurance to access subsidies or cost-sharing reductions, or finding resources to lower the cost of medications through copay cards, that kind of thing.
Yeah. I'll see if my guys that know how to do this stuff will put links and stuff on here so people can click on there and go straight to
It'd
it.
be awesome.
But yeah,
that's how we keep our doors open.
Yeah,
so
but you're
it really
doing
matters.
So the third Friday. See, I always say the third Saturday in October because that's when Tennessee always plays Alabama. But that doesn't concern a Vanderbilt fan.
Well, actually,
yes,
my dad still holds an SEC record for the longest interception return against Alabama in 1968 or 69.
You're kidding.
No, and Bear Bryant wrote him a letter to congratulate him.
Tell me that letter is still somewhere.
He has it. And the pigskin. I mean, they had real pigskin footballs in the 60s.
Yeah.
And it sits on his mantle.
Wow.
I love telling people that.
That is
it's so
awesome.
funny. Isn't that fun?
Wow.
I know.
What was your dad's? What's your dad's name?
His name's Christy Houck.
All
Number
right.
32.
Number 32, Christy Houck. All right. That's awesome.
I know. I think it's kind of awesome.
That's
too.
really cool.
He is a really amazing supporter of what we do now.
Yeah.
It just took him a little while to understand it.
But Friday, the third Friday.
Yeah. So the 20th of October is Heal the Music Day, and
Right
we'll
on.
have a really cool auction around that time with Julian's. It's a global auction house of handwritten song lyrics.
Oh, cool.
And they're all over the map, from country hits to indie to rock. It's always really fun to see.
That's awesome.
What comes in. And then we go right into open enrollment, where we don't look up for 6 weeks.
You don't, do you?
We don't.
No, I know.
But it's worth it. We'll see about 7,000 clients in that 6-week window.
Well, yes, for those folks who are watching and listening to this, when you go to concerts, which I know lots of folks that are listening to this are music fans. Mm-hmm. All those guys up there on the stage, that's who we're talking about.
All of them. And the bus driver, and the people who clean the bus, and the guys in the studio who are recording the music, and the writers who are writing it. And the industry is vast, and there's so many pieces of it. Some of them I didn't know existed until COVID.
Yeah.
Truly. But it takes all of these pieces to make the bus go.
Yeah. Well, I'll say it again. It's miraculous what you guys do, and it's a lot of hard work. I know, sometimes miracles just happen without work, but what you do is hard work. And I know personally, for me, speaking for the musicians and the singers and the artists and songwriters, thank you for what you do. It's a blessing, like for real blessing. And like I said, I've seen it in action, and it's really amazing what can happen. And it's a godsend, really. So, Tatum, thank you so much. And
thank you.
And we should do this again sometime.
Yeah.
We should figure out a way to collaborate on something else.
I would love that, because I'm a fan of Chris Hennessee from Tennessee.
I'm a fan of everything that you do. So,
and I'm a fan of your wife and kids, too.
They're great. They are. Yeah, they're
are
pretty great. So here's a little funny inside information for you about Miss Judy. Miss Judy here decided that camera that's facing me was just going to shut off. It sure did. So as I do it's only you now. So as I do my exit, I'm going to pull this over here. And Tatum, thank you so much, dear. I appreciate you.
I love it.
Love what you guys do. And watch this.
There we go.
All right. So until next time, fully armed, folks, pick up your Bible, put on your armor. We'll see you next time, fully armed. Thank you, Tatum.
Yay.
All right. Well, guys, that was Tatum Allsep. Thank you so much for checking it out, hanging out with us at Fully Armed. Don't forget, subscribe, like, follow, pass this along to all your friends, and hope you enjoyed it. We'll see you next time on Fully Armed. Thanks.